School districts, of course, are making plans to reopen, and many viewers have reached out to us with questions about going back to school and staying safe. So, as we always do, we turn to our health expert, Dr. Payal Kohli, to answer some of those questions. Good morning. First off, if students are, say, 6 feet apart in a classroom setting, is it safe if they're not required to wear a mask throughout the entire class?
Good morning, Gary. This is a complicated question. So the simple answer is no, it's not safe. But the actual truth is that it's really very complicated. So let's talk about this. We've always actually said that masks and social distancing are not replacements for each other. They're actually doing slightly different things. And the reason is because although most droplets fall within that 6 feet range and they fall to the ground, there are a lot of respiratory emissions like a cough or a sneeze that can actually go a lot farther. Science has shown us that a cough or a sneeze could go up to 27 feet. So if a child is sitting in a classroom, happens to cough or sneeze suddenly, it can travel a lot farther. The second piece of that is to think about the ventilation. So we're realizing now that ventilation is actually a very important part of transmission with COVID-19. And so if you're sitting in a small classroom with poor ventilation, it's probably going to be extra important to wear those masks. Whereas if you're sitting in an outdoor classroom or an area with great ventilation, they may become less important. And finally, what we're learning is that different kids actually transmit the virus differently. So some studies have shown that kids under the age of 11, even if they're infected, are very unlikely to transmit the virus through their droplets, as opposed to kids over the age of 11. And we also know that younger kids have more challenges wearing masks and may actually touch their face more. So the rules may be different for elementary school kids versus high school kids.
Makes a lot of sense. Yeah, you mentioned the ventilation. We got a lot of questions about that too, because a lot of people know in these older schools ventilation is not great. We got a question, what sort of ventilation system should there be in order to keep people safe?
Yes, ventilation is really very important. So good to think about this. So actually the best type of ventilation system is being outdoors. So what the CDC is recommending is actually trying to dilute the indoor air with outdoor air up to 100%. So try to bring in as much outdoor air as there is indoor air. And you can do that with opening a window and, trying to have outdoor classrooms, those types of things. Now, if that's not possible because the building is old and it's all closed in, they're also recommending installation of ventilation systems like air filters, air purifiers, and exhaust fans. Now, it's really important that these are installed correctly. And it's also important to know that there's no hard science that shows that they work, but based on how they work, we think that they're likely efficacious. And then finally, the CDC is also recommending that schools install something called UV germicidal irradiation, where they're actually using UV light as well to try to really purify the air that's being ventilated.
All right, Dr. Kohli, as always, we appreciate your input.